Hello, I'm Dr. Melissa Piliang, and on behalf of my co-authors, I am pleased to present the key highlights from an integrated analysis of the efficacy and safety of ritlecitinib over 24 months from the ALLEGRO Phase 2b/3 and long-term Phase 3 clinical studies in alopecia areata. Alopecia areata, or AA, is an autoimmune disease with an underlying immunoinflammatory pathogenesis characterized by non-scarring hair loss on the scalp, face, and/or body. Ritlecitinib is a once-daily oral selective JAK3 and TEC family kinase inhibitor that demonstrated efficacy versus placebo in the pivotal ALLEGRO Phase 2b study and is approved for the treatment of severe AA in adults and adolescents aged 12 years and older. This interim analysis included patients aged 12 years and older with at least 50% scalp hair loss due to AA who received ritlecitinib 50 milligrams in the ALLEGRO Phase 2b/3 study with or without a 200 milligram 4-week loading dose and rolled over to the ongoing Phase 3 open-label ALLEGRO LT study after up to 48 weeks. Efficacy analyses are reported through month 24 based on either observed or last observation carried forward data to account for missing data, and safety was assessed throughout. The analysis cohort comprised 191 and 194 patients in the ritlecitinib 50 milligram and 250 milligram groups, respectively. Demographic and baseline disease characteristics were similar across the treatment groups. At month 12, 45.1% and 40.3% of patients in the 50 milligram group and 45.9% and 41.8% of patients in the 250 milligram group had a SALT score of 20 or lower in the observed and LOCF analyses, respectively. After 2 years, at month 24, these proportions increased to 60.8% and 46.1% in the 50 milligram group, and 63.1% and 50.8% in the 250 milligram group. Of SALT less than or equal to 20 responders at month 12, 79.7% sustained this response through month 24. For eyebrow growth, 57.6% and 46.8% of patients in the 50 milligram group, and 61% and 50.9% of patients in the 250 milligram group had an EBA response at month 24. For eyelash growth, 51.2% and 43.2% of patients in the 50 milligram group, and 62.7% and 51.7% of patients in the 250 milligram group had an ELA response at month 24. 70.0% and 56.6% of patients in the 50 milligram group, and 76.4% and 65.5% of patients in the 250 milligram group achieved a PGIC response at month 24. The 4 most common adverse events were positive SARS-CoV-2 test, headache, nasopharyngitis, and upper respiratory tract infection. This safety profile is consistent with the overall safety profile of the ALLEGRO clinical program. The incidence of serious and severe adverse events were similar between groups, while a higher proportion of patients in the 50 milligram group experienced permanent treatment discontinuation due to adverse events compared with patients in the 250 milligram group. Adverse events of special interest are shown. In summary, ritlecitinib had clinically meaningful and sustained efficacy up to 2 years, and the long-term safety profile was consistent with the overall ritlecitinib clinical development program in AA, supporting its long-term use in patients aged 12 years and older with AA and at least 50% scalp hair loss. As ALLEGRO LT is ongoing, future analyses will provide further information on the long-term efficacy and safety of ritlecitinib.